If a patient reports a sensation of motion or that the environment is whirling around external to the patient, what is that sensation called? Is it dizziness or is it vertigo? So please read and become familiar with all the questions that are noted under general health history and problem-based history in your textbook. When doing assessment of head, eyes, ears, nose, and throat, you will start by inspecting patient's head, facial structure, eyes, ears, nose, mouth for any kind of abnormalities. You will assess their visual field for peripheral vision. Ask them if they have any problems with their vision. If they do wear any glasses, ask them what do they use those glasses for, or what are their contact lenses for if they're using contact lenses. Patients' eyes should be moist without any drainage or excessive tears. When assessing patient's ears, make sure to check behind your patient's ears, especially if they wear glasses or if they are wearing nasal cannula in that clinical setting, because either of those could cause skin breakdown by rubbing against the skin. By looking at them, you should see that trachea is midline. Their eyes, ears, eyebrows should be checked for symmetry. If you palpate any area, it should be without any tenderness and edema or swelling. But if you find any of those, you will note them accordingly. You will assess their hearing based on response from conversation. For example, pay attention if they're straining to hear what you say, if they're leaning forward to hear you, if they're asking you to repeat whenever you say something, or if they tell you directly when asked about having any hearing deficit that yes, they do have a hearing deficit. When you test visual acuity or distance vision using the Snellen chart, place chart on the wall in a well-lighted room. The patient may sit or stand 20 feet from the chart. If the patient uses contact lenses or glasses, he or she should leave them in place. After completing the test, here is how you will read the findings. The reading pattern should be smooth. The expected finding is 20/20. A finding of 20/30 means that the patient can read at 20 feet what a person with normal vision can read at 30 feet. If the patient can read all but one letter in the 20/30 line, document the finding as 20/30 minus 1. To determine the pupil size, you can use the pupil gauge found on your pen light. To assess reaction to light and consensual reaction, first dim the room lights. If possible, ask the patient to hold the eyes open and fix his or her gaze on an object across the room. Approach with the pen light beam from the side and shine it directly on the pupil. Observe the pupil receiving the light for the direct reaction and the other pupil for the consensual reaction. Repeat for the other eye. When you're doing that, please give a forewarning to your patient that you will be shining the light in their eyes. Okay, and always come from the side. Never just directly holding the pen light in front of their eyes. So now what I will be doing is I will be checking your pupils, okay? I will be checking with this pupil gauge what size your pupils are, and then I will be dimming the lights later on to shine the light in your eyes, and I will have my hand in between your eyes here just to partition it, and I will be shining light from one side at a time, okay? So let's check the pupil size first, okay? You just kind of stare at my nose if you can. I got 4 millimeters on left side. Kind of check it on this. Yeah, 4 millimeters on that side too. So now I'm going to go ahead and dim the lights and shine the light in your eyes, okay? Alrighty, so just gonna keep looking at my nose tip here, okay? Here comes the light. Other side now, okay? So I'm gonna turn the lights on real quick. So your Pupils are equal, round, and reactive to light. That's what we were checking at that time. And reaction is consensual in both eyes. If you ever test a patient for accommodation, ask the patient to fix his or her gaze on a distant object across the room. Then ask the patient to shift his or her gaze to your finger placed about 6 inches from patient's nose. Your expected findings, the pupil diameter will normally be between 2 and 6 millimeters. Pupils should be round and equal in size. The illuminated pupil should constrict as a direct response. The other pupil should constrict simultaneously, which is known as consensual response. The pupils should dilate when visualizing a distant object and constrict when focusing on a near object. So pupils constrict when focusing on a close object, C goes with C. Pupils dilate when focusing on a distance object, that D goes with the D. We won't be doing accommodation in this course, so you will be documenting or verbalizing your documentation as pupils are equal, round, and reactive to light if those are your findings. Remember, if you are checking accommodation, your patient should be able to follow direction for you to test accommodation on them. Do not document accommodation if you have not tested them for accommodation. If you see a mnemonic like parla, place a side note in the comment section that accommodation was not tested.